Some people quietly blend into the wallpaper. Then, 12 months later, strangers do double takes, and brands slide into their DMs. It's not a mysterious glow up or a secret gene. It's 5 practical, boring-ish changes done properly. Think less overnight miracle and more stop doing 5 tiny things that age and flatten your face. This script is the no-nonsense version. Clear problems, clear fixes, a little sarcasm, and 0 miracle cures. Try the fixes sensibly. Don't panic if one week looks the same as last week. And for anything medical, check with a professional. Flaw 1. Facial bloat. Why you look softer than you actually are. Problem. Your face looks rounded, sleepy, or I just ate a bowling ball. And that softness hides your cheekbones and jaw. It's not cruelty, it's fluid and low-level inflammation doing a cozy couch potato impression on your face. Practical fixes. Start with the obvious stuff nobody wants to hear. Less late-night pizza, fewer salty snacks right before bed, and dial down alcohol if mornings look like a pufferfish convention. Add potassium-rich whole foods, bananas, sweet potatoes, avocados, and try coconut water or plain water throughout the day instead of chugging at night. Timing your hydration helps the body stop hoarding fluid overnight. Introduce mild natural diuretics like green tea or dandelion tea once daily if you tolerate them. They're not magic, but they can help shift overnight retention. Small habit. Eat your heavier meals earlier and sleep with your head slightly elevated. Single extra pillow or a small wedge. Expect subtle improvements in a few weeks if you're consistent. If you have high blood pressure, kidney issues, or on medication, check with your doctor before changing diet or diuretics. Flaw 2. Hormone and energy basics, the low-key engine behind how you look. Problem. Low energy, puffier skin tone, and a general meh. Look often follow a worn-down hormonal environment. Not necessarily a crisis, but enough to make you appear tired and soft. Practical fixes. Reset basic biology before buying supplements. Morning sunlight, 5 to 15 minutes on face, chest, less if you burn easily, helps circadian rhythm and vitamin D pathways. It actually tells your body it's daytime and can lift energy. Eat a protein-first breakfast, eggs, smoked salmon, Greek yogurt, or a protein-based smoothie to stabilize blood sugar and support muscle and skin. Add consistent resistance training, even simple body weight or 2 strength sessions a week, and short cardio bursts. Exercise is one of the most reliable, non-controversial ways to nudge hormones in the right direction. Manage booze and stress both blunt your gains. If you suspect clinically low testosterone or other endocrine issues, get lab work and see a clinician. Don't self-diagnose from a forum. Flaw 3. Jaw and tongue. Posture. How tiny posture changes accentuate bone. Problem? A weak jawline is often not a mystery of genetics alone. Modern posture, mouth breathing, and lazy tongue position flatten how your face presents. Practical fixes. Learn gentle tongue posture. Rest the whole tongue lightly against the roof of your mouth, just behind the front teeth, with your teeth slightly apart and lips closed. Don't clench or force it. Think rest, not push. Add short jaw conditioning habits, chew firmer, fibrous foods a little more often, and try short sessions with a resistive chewing gum. Start low, think 5 minutes per side, a few times a week, and stop if any jaw pain appears. Simple facial exercises can help. Chin tucks, gentle resisted mouth presses, and slow neck posture drills. Avoid aggressive gadgets or extreme routines online. They can hurt TMJ. If you have chronic jaw pain, noticeable bite issues, or orthodontic concerns, consult a dentist or orthodontist before doubling down. Flaw 4. Sleep equals look. What happens when your repair crew is absent? Problem. Poor sleep steals skin repair, increases puff and dark circles, and makes you look older and flatter, night after night. Practical fixes. Sleep hygiene is boring but effective. Aim for consistent bed and wake times. Sleep on your back with a slight head elevation to reduce facial fluid pooling. If that's uncomfortable, adjust gently. Make the room dark and cool. Most people function well with a cooler bedroom and minimal light leakage. Power down bright screens 30 to 60 minutes before bed. Read, stretch, or do light breathing instead. Morning routine. A few cold splashes or a brisk face rinse, followed by gentle lymphatic massage, light strokes from the center of the face outward, to wake circulation and reduce morning puff. If you suspect sleep apnea, restless sleep, or severe insomnia, see a sleep clinician. Fixing sleep is a high leverage move for how you look and feel. Flaw 5. Hair. Stop copying haircut memes. Why the wrong cut ruins progress. Problem. You can overhaul skin, sleep, and posture, but still look off with a haircut that fights your face and hair texture like an ill-matched Tinder date. Practical fixes. Think texture and density first, face shape second. Find a barber who asks about your hairline, cowlicks, and daily routine. And bring 2 to 3 photos that match your hair texture, not just a random celebrity with different thickness. For styling, towel dry, gently. Apply a small amount of a matte product or sea salt spray for movement, and shape with fingers. Simple routines win because they actually get done. Hair maintenance? Don't overwash. Most people do fine 2 to 4 times a week depending on oiliness. Use conditioner on the ends and consider a weekly scalp rub to improve blood flow. If thinning is a concern, see a dermatologist for options. Don't trust sketchy miracle cures online. Close, call to action, wrap with a little grin. Fix the puff, support your hormones with real habits, tidy your tongue and jaw posture, prioritize sleep, and treat your hair like the frame it is. 5 sensible moves that add up. No promises of instant celebrity, but do these consistently and people will notice the difference. Try one change this week, then add another. If you plan to take supplements, dramatically change diet, or chase hormonal fixes, check in with a healthcare pro first. And if you try any of this, don't blame me if your crush suddenly asks for your hairstylist.